Well, good afternoon. I'm Nate Fluharty, and this is a new edition of Healthline 3, where we love to focus on ways to live a healthier and a skinnier life. Over the next 30 minutes, we're going to be taking your calls and answering the questions that you have. And today, it's all about weight loss. So you can pick up the phone, give us a call between now and the next 30 minutes, and the number is really simply 318-219-4569. Again, this show is focused on you, the viewers, and we really want to get your questions answered. So today's featured guests are Irina Haas-Gaddis, the co-owner and CEO of Shed It Weight Loss, and Catherine Rogers, a physician's assistant with Shed It. So ladies, thank you so much for being here with us today.
Thank you for having us.
Yeah, it really is a very important topic. You know, we always want to lose weight. I know, I don't know too many people, including myself, that don't want to lose weight. And you're here to talk about some ways to do just that. We really do appreciate it. And what a very timely thing because of New Year's resolutions, too. And you said that now is one of the most popular times of the year for Shed It, and I can see why.
Yeah, that is correct.
Yeah, so that's pretty cool. So, ladies, let's just jump right into it. Let's first talk about what your roles are at Shed It and kind of some of the things you do. And Irina, we'll start with you.
So I'm the CEO. I do all the fun business stuff. Since we're a small business, I basically do everything. I have a lot of hats, from purchasing to marketing to accounting. I do it all. I'm also in touch with several of our partners, like meal prep partners that we have, gyms that we have, our nutritionist. So I'm basically the coordinator, like I bundle everything together, so that our amazing providers can focus on the patients.
Absolutely, you're the head honcho.
Exactly.
So, absolutely, love that.
But I usually stay more in the background.
Okay.
Yeah.
Well, that's cool. And I know, when it comes to something like this, it has to be a passion for you.
Absolutely.
It probably has been for a long time,
Yes.
I imagine.
Yeah. A healthy lifestyle has always been my passion. Not only me coming from Germany, it's a different lifestyle over there. And now that I have kids of my own, I want to teach them how to eat healthy, how to move. My husband is a physician, so I know what is connected with problems that you can get with obesity.
Yeah.
And I just try to help the community and my family as well.
And we do appreciate you being here. In the Shreveport-Bossier area, Louisiana, of course, when you look at the numbers, it is not the healthiest state out there. A lot of people tend to be overweight. The food is so good. I think that's one of the first things. I gained several pounds when I moved here 7 years ago. So it is important to kind of have that balance, and that is something we're going to be talking a lot about. Now, Catherine, let's talk about your role as a physician's assistant and how you help Irina out.
Yeah, so I'm the physician assistant at Shed It. Born and raised pretty locally to Soda Parish, and then now Shreveport for the last 10 years or so.
Go Griffins.
I have been a PA almost 7 years, and then 6 of those were in inpatient cardiology. So I've recently moved to Shed It, and I like the outpatient setting, but really being able to see people, discuss any kind of past medical history, and then come up with weight loss goals and the safe way to, healthy way to get there. And then it's rewarding to see people, reversing things like insulin resistance. Some people get off of blood pressure medicines, correcting cholesterol, just regulating blood sugar better, to see them overall reverse long-term health conditions that, I would see previously in the hospital, and kind of, long-term side effects of things that we don't realize are important at the time. So.
Yeah, and you touched on something very important there. Of course, cosmetically, we want to look our best.
Sure. We
want to lose weight, look thin and trim. But most importantly, I think deep down for folks, the ultimate goal has to be healthier, to cut down on diabetes and to have a stronger, better heart.
And longer. Yeah.
Absolutely.
So.
All right, very cool. Well, again, that number, let me throw it out there one more time, 318-219-4569. If you have some questions, if you've been dealing with some weight issues yourself, now is the perfect time. If your New Year's goal is to lose a couple of pounds, these are the ladies to talk to. So give us a call. We're going to have those phone lines open right now, as a matter of fact. So ladies, let's just jump right into this conversation. And Irina, we'll talk about some of the things that you offer at Shed It that can help people on those goals.
Yes. So we offer the very popular weight loss medications called semaglutide and tirzepatide. These are weekly injections, subcutaneous, like under the skin, that help regulate your appetite. And this is how you lose the weight. We recommend that in addition to that, you also meet with our nutritionist, because we are offering a comprehensive plan, and nutrition is a very important part of it. And we also recommend that you start doing exercise, some kind of moving. And in addition to that, we also do bioidentical hormone replacement therapy, because a lot of especially middle-aged patients, men and women, are starting to have some hormone imbalances. This just comes with age and happens to everybody. And I'm at the brink of that, so it is also something that is interesting to myself.
Yeah, I think so. Now, how does that coincide with especially losing weight when it comes to your hormones and that? How do those two pair together?
It's like your body usually works like a clock, and as you get older and your hormones get less, the clock gets basically out of their tick-tock. So it's a very easy way to explain that. And so you can supplement by bringing it back to how it was supposed to be. For instance, I have very high cortisol levels. I mean, I have a high-stress job. I have 2 little kids. Juggling everything is, it's demanding. So with that comes sleep problems. When the cortisol is high, you get sleep problems, which do not really help with losing weight or keeping your weight off. And I'm a great example myself, because I'm experiencing a lot of these issues. And
that's interesting. And I'm sure, for men and women, they could probably, it sounds like the issues can be very similar, but I'm sure they're dealing with different things. For guys, it's got to be testosterone and things like that.
Yeah.
Right. Think of your hormones as like your body's little messengers, and so there's 5 different ones that we test for with our bioidentical hormone test. But anytime any of those are low or even high, we have to get those back into a balance, because if they're not perfectly in balance, and we have things like stubborn weight gain, people have night flashes, hot sweats, low libido, low energy, trouble sleeping at night. So it really is a fine-tuned balance of all of those for everything to run properly.
Interesting. Now, I'm sure you have to get a baseline. You have to figure out where people are when they start this. So I'm sure, do you do a series of tests when they come in and start this process?
Yes. So we have a sit down with the provider. We, like I said, go over medical history, goals that you want from hormone replacement therapy, and then a series of other questions. And then we have a saliva test that we check. So that's going to test cortisol at different times of the day, as well as the testosterone, estrogen, progesterone, DHEAS, and then the cortisol, like I said before. So then we send that off, and then we work with the clinical compounding pharmacist to come up with a treatment. But we do test through saliva.
Okay, so you keep the injectables at a bare minimum there. It's not like you're going through, poked and prodded for hours and hours. Right, it's not a long process.
There's follow-up kind of, testing after we get everything back in balance, but it's not a ton of needles.
That's good. It's kind of touching on all the things here. Now, Irina, you brought up an interesting take here. I think a lot of people watching right now, parents specifically, and I think that the sleep kind of jumps off. For some of us, it's like, I got a bad night's sleep, so what? But you can only do that so long before it starts affecting your overall health and your weight too. That's pretty wild.
Exactly.
Yeah.
Yeah, you have just less energy to also work out. For me, I try to work out in the morning because it gets my energy levels up, and I have a better day if I work out in the morning. But of course, I'm busy, so it doesn't always go that way. But sleep is really, if you don't get adequate sleep, it has a lot of negative consequences on your entire life. Yeah,
it sure does. Let's backtrack just a second. You brought up some of the drugs that you use to help people. Now, that is something that, but you guys have been helping us out doing these Healthlines for, it seems like more than a year, but it seems like in these last couple of months specifically, things like Wegovy, Mounjaro, these, it's every day we're doing these stories on these drugs. And is this something, do you use these? Are these similar to what you were using? Because, people, a lot of people are using these.
Exactly. So we are using the compounded version. So Wegovy, Ozempic, Mounjaro, Zepbound, these are the brand names.
Oh, okay.
These you can either get if you have diabetes or if it's approved by your health insurance for weight loss. Right now it is very difficult to get those approved, even if there is so much demand that they cannot supply.
Right.
So what we do, and a lot of other companies, of course, we offer the compounded versions, and the generic name is semaglutide for Ozempic or Wegovy,
Sure.
and tirzepatide for Mounjaro and Zepbound.
Okay.
And this is available from compounding pharmacies, and we have a great partner.
Fantastic.
Yeah.
Now, just essentially break down what these drugs do.
Yeah, so these are GLP medications. They were initially used in diabetes, and still are obviously, but they increase enzymes on your pancreas to produce more insulin. So as your body takes in, food after meals, we have these blood glucose spikes. This increases that insulin production, so your body runs at just a more regulated level. And then as a byproduct of that, they realize that they slow your GI motility. So your stomach is slower to empty out its contents. So as you start to eat, you feel fuller sooner and then longer. So that's how we see the additional benefit of weight loss, is because number one, we're just running at a more regulated state. And then number two, we are able, and especially in partnership with nutrition and, good choices, able to have, less of an appetite and be able to eat less and make better choices there.
And what has been the success rate that you ladies typically see?
I would say it's successful for everybody. I've had many patients tell me, I've tried everything. I've, tried this diet, that diet, this, that, and the other, and then this was the only thing that was successful for me.
Fantastic. Yeah, that's great. Well, we're about a third of the way through. We're speeding through this Healthline, so I know there's some people watching. Don't be scared. Now is the time to pick up the phone. Give the ladies a call if you have a question about weight loss, how Shedded can help you. That number is 219-4569. And if your New Year's resolution, lose a couple of pounds, do it safely and easily, these ladies have just the ideas for you. We've talked a lot about those drugs. I mentioned that. But what is the process? I know some folks out there watching right now thinking, okay, this sounds great. I'd like to try this. But do they reach out to you? Do they reach out to their primary physician? Is there a chain of command, so to speak? Walk us through that.
So you do not need a referral of any kind.
Wow.
You just call us. Our number is 318-746-3880. You can schedule the appointment with our office staff, and then they bring you in to see Catherine, and you discuss your health history, your weight loss goals, your budget, and Catherine comes up with the right plan for you.
All right, that's simple enough. Now, we mentioned the results. I think we have some pictures we want to show you right now. And ladies, what are we looking at right here?
These are before and after pictures.
Same person, right?
Oh, yeah.
Okay, yes. Wow, those results look pretty promising, I'd say. Fantastic.
Yeah, there's really patients that you would not even recognize before and after.
Wow. Yeah, that looks like a completely new person. That's why I'm glad I said that this is the same people, the before and after.
It's the same people.
That is fantastic. So yeah, Catherine, when you start this process for people that come in, I mean, everybody, of course, I'm sure they say they want to lose as much weight as possible, as fast as they can. We got these Mardi Gras balls that we need to go to. We need to slip into that skinny dress, the black tux, and things like that. But I'm sure it takes some time. What are some things that once people come in, they do that test, and you find out that, okay, we can help you. What's the next step? Walk us through that.
The overall goal is to do it in a healthy way. And so we have a packet of information that we give, really in tune with the nutritionist, kind of, exercise, that kind of thing. We set realistic goals. We don't want to try for too much weight loss or too fast, because then there are, side effects that could happen that we want to not have. And so we try to do everything, like I said, healthily, focusing on good protein, focusing on good strength training and exercise, that kind of thing. And then overall wellness. So we don't want to just have somebody come in and, miraculously lose 100 pounds in 2 months, because that's not sustainable and then it's not healthy. And so the goal is really just overall improving health and wellness.
I like that.
While losing some weight.
Okay. Now
and what I also would like to add, we have a Fit 3D body scanner, which is actually a really cool tool, because it measures your fat mass and your muscle mass, and we want our patients to lose fat and not muscle. So it's a great tool to track, and it's very motivating when you see over a specific amount of time the shrinkage. So it's a very powerful tool, and of course it's included to the visit. It's free for the patient.
And I'm sure that's so important, because you always hear that muscle weighs more than fat.
Mm-hmm. Yes.
So, all right.
And you need the muscle to keep up your metabolism. So you always have to keep in mind they will be alive at some point after medications. So you have to keep that in mind, that you don't want to destroy your metabolism, because at some point when you eat normal without the medication, you have to have your metabolism going strong so you can keep the weight off and sustain.
Great point. Yes. All right. Well, we got our first caller on the line. We have Ivy. Ivy, what is your question for the ladies of Shed It?
Yes, sir. I want to know, how do you qualify for this procedure? Do you have to be on medication, off medication?
Thank you for calling. So there is, everybody can come see us. There is no referral needed. However, we are an out-of-pocket clinic. Unfortunately, these services are not covered by health insurance. But you can come in. Everybody can come see us. It's very easy to schedule. Just call us at 318-746-3880. And my amazing receptionist, Kelsey, and my office manager, Holly, will schedule you.
Where's your office located?
We are in Bossier City, and the street is 2211 Shed Road in Suite B. It's the purple door.
2211?
Yes, ma'am. 2211 Shed Road. Shed it on Shed Road. That's our
easy.
slogan.
Yes.
22 letter, Suite 11?
Suite B.
Suite B.
Okay. It's the purple door of the white building. Yes, ma'am.
Okay, I'll be up there and talk with you, okay?
Yeah, that would be exciting. Thank you so much.
Yeah, good call,
Thank
Ivy.
you.
We appreciate it.
Thank you.
Yeah, Shed It on Shed Road. Boy, that's just kind of cleared up a lot of a lot there. Ladies, you typically, losing weight isn't something that just young people want to do. I mean, we have senior citizens that are like,
Oh, yes.
I could probably lose a couple of pounds. So let's talk about that. What do does your treatment plan change based on the age, or what are some things that you do to kind of tweak things for people of different ages?
In general, we always sit down and we have go over the past medical history, that kind of thing. These GLP medications that they have, what they've studied so far, have been shown to be helpful for blood pressure, type or heart failure with preserved EF, which just means not a weak heart, a strong heart. Those help in that. Liver disease, there's been some off-label for like addiction, different things. So far, everything that they've shown for these medications has been good. And so especially as we have kind of older people that are wanting to reverse some chronic health conditions, these are honestly more beneficial than any other way to try to go about weight loss.
And we actually have patients in their 80s.
Do you? Okay. Wow.
Yeah, it's never too late.
Yes.
They want to be longer around for their grandkids.
Yeah.
Don't have trouble getting up and down because there's too much pressure on their joints. So, yeah, we are happy to help.
That's fantastic. Now, this is also the time of year. I mentioned off the top New Year's resolutions, wanting to lose weight, but it seems like every year there's something out there that's, the new fad diet. You need to try this, you need to try that. What are some things that you've typically seen in the past that you might say, that may not be the best route?
Keto.
Keto, okay.
It's just not sustainable.
Okay.
I'm sure you can lose a lot of weight with that, I think in a pretty timely manner. Not sure how cardiologists see that. But also, can you really imagine to keep that for the rest of your life?
Yeah.
Yeah.
Yeah, I think anything that is not going to be sustainable is not just a good option long term.
Okay. Well, I ask because, everybody wants to try something. The promises are out there. You do this and it's going to work. Now, for me personally, I've tried fasting. That's what I've been doing and really trying to, and I've seen some results. But the minute I start eating again like a normal person, guess what? That weight comes back. So it is a very finicky thing. And I know we got some viewers out there that's like, oh yeah, I've heard about this, I've tried this, and this doesn't work. Yeah. But I find one thing that we hear is that the medication, it works. And it kind of, it's effective because it makes you're going to see the results. And I think that once you see results, that's a motivating factor.
Absolutely, yes.
Yeah.
Yes.
And then another thing to note is that kind of once we get you to where you want to be, then we have an exit strategy as far as maintaining and then getting off of the medication, because it's not feasible to be on it forever. Some people do it just for the health benefit of it in general, but we have exit strategies and way to maintain and things like that kind of once we're where we want to be.
Let's talk about that. You know, I'm sure that when you come in, you would talk to the patients, you help them out, but what happens, you know, during during the time they're taking the medication and after? I mean, I'm sure you don't just cut people loose and push them out the door and say, good luck, be skinny.
No.
So talk about that.
We have a few months of kind of a weaning process. We can do one of two ways. We either decrease their dose or have them can start to stretch out because it is a once a week injection. So one of two ways there as far as weaning the medicine down. And then we have, like I said, the nutritionist on staff and different things kind of in play as far as getting them comfortable and then not just, you know, sorry, out the door. So
Yeah. So you guys have a whole team. I love the fact that you have a nutritionist there.
Yeah.
So, okay.
And as far as I know, we're actually the only weight loss clinic in town that have a nutritionist on staff.
Oh.
So, and I think it's pretty significant because nutrition, in my opinion, is probably the number one thing.
Yeah. I would have to agree. I mean, and I'm sure that it's got to be nice for your patients. You go out to dinner somewhere and, you know, you want to dive into this dish and, oh, this looks so good.
Yeah.
Should I be eating this to begin with? And to be able to have someone where they can pick up the phone and give them a call or something as simple as that.
Exactly.
That's got to be huge. Now, what about when it comes to coming up with a, you know, I think you mentioned fitness is another big thing. When it comes to coming up with a workout routine, so to speak, is there someone there at Shedit that can help them out with that? And how does that process work?
We don't have a person on staff doing that. However, we have some fitness referral partners.
Okay.
There's also actually patients of ours that do jazz aerobic, and there's also one lady who does like pole dancing classes.
Okay.
Also, it's a group setting. It's like a women's fitness workout kind of thing.
Yeah.
So there is people that offer that, and it really depends on the person because some people want to work out in a group. And do group sessions. Then some people would rather work with a personal trainer. Some people just want to go to the gym. Like me, I'm focused on my gym. Don't even talk to me. And everybody's different, but we have referral partners for that.
Fantastic. Okay, I like that. So you were you keep your eye on the prize. You get to the gym, you do the work, and you get out of there, right?
Exactly.
Fantastic.
Exactly.
I like that. Well, hey, we got just about 8 minutes left. We're going to cut the phone lines off with 3 minutes to go around, let me think here, 12:27. So we got 5 more minutes. If you got a question about weight loss, these are the pros. These ladies know what they're doing, and they can help you out in a big way. So 318-219-4569. Mentioned just a couple of minutes to go. So if your New Year's resolution is to lose a couple of pounds, now's the time to get some ideas on how to do that. Now, one thing I wanted to talk about, Catherine, explain what the Gallery test is. I hope I'm saying that right. What exactly is that? I know you guys are pretty proud of that.
Yeah, so that is a new up-and-coming test to test for a certain kind of cancer. So
Wow.
statistics now say that 1 in 3 people will have cancer. I think some of that's just environmental stress, different things. Some of it's genetic. But right now, so out of all the cancers that we have, there's 5 that have a routine screening process for. So breast cancer, you get a mammogram. Prostate cancer, they check PSA levels. Colon cancer, they do colonoscopy. Cervical cancer, they do pap smears. And then lung cancer, especially in smokers, they check like serial CT scans of your lungs. So, but those are like the only 5 that have a routine screening and process. And then like another umbrella there's 95 at least other kinds of cancers that don't have any routine screening in place. So, you know, things like pancreatic, gallbladder, all these different cancers, actually 7 out of 10 people will pass away from these other cancers because they don't have a good routine screening in place. So this is a new DNA test that's able to go in and check for certain things from those other 95 cancers. Early detection is key in cancer. You know, if you can find it before things have spread, sometimes before you even have symptoms. So this is a new up-and-coming test there where we're really delving into that. The co-owner of the clinic is an oncologist, so you have a sit down with him and then come up with, you know, goals, treatment plan, that kind of thing. So.
Yes, we've heard that time and time again that early detection is key when it comes to dealing with something like cancer. You mind breaking down how the test goes?
We run it through the lab. I know that it's just DNA sample, and so I don't know I know it checks for like the methylation of genes.
Is that like a swab of the mouth? I'm sorry to interrupt.
It's a blood
like
test.
the
It's a
blood
blood
test.
test.
Okay,
Test, yeah.
I gotcha.
Yeah, so it'll check for methylation of gene, not mutation of gene. But then if anyone's interested in that, we'll have you sit with our oncologist and then really delve into some of that. But it is DNA to look for the shed of cancer cells in the bloodstream.
Wow, that is fascinating. Yeah, that's hard to believe. Is this something that would be covered by insurance, or is this kind of outpatient stuff too?
No, unfortunately, this
Yeah.
is not covered by insurance. However, the company that offers it, they do payment plans, and you can also pay with your HSA or FSA card.
Wow. Okay,
And
fantastic.
it would be like an annual thing, or
Yeah.
maybe every other year.
Sure. Well, it's for something like that, that's priceless to find out,
I
ahead
totally
of
agree
time.
with that.
So,
Yeah.
okay, that is wow. That's so great that you offer that. Now, I was kind of checking out things on that Shed It offers. There's a lot. I thought it was just weight loss, and then I hear about this test, and there's so much more too. You mentioned this before, our caller Ivy. Now, let me get the phone line out. We're gonna close up the lines here in just about 2 minutes. So if anybody has any questions, 219-4569. Again, give the ladies a buzz. Let's bring it back to that 3D scan you were mentioning and how important that is to be able to decipher between muscle and fat. Now,
Yeah.
for those that don't know, why is that so important?
The most important thing is you want to lose your fat, and you need to keep your muscle because this is how your metabolism works. So this is how you burn the energy. If you lose a lot of muscle mass, it is basically impossible that you can keep your metabolism, and so your food intake will be even harder. Like if you eat normal, you don't burn enough calories.
You have to continue to decrease your calorie intake if you don't have your metabolism.
At some point, it's not possible anymore, because if you eat regularly, let's say 2,000 calories is usually the average diet recommendation, which is actually, in my case, it's too high. If I eat 2,000 calories, there's no way I can keep off my weight, although I work out. And I have muscle mass. But you see,
I had no idea that it varied for different people.
Oh yeah.
Huh.
Yeah, this is why it is so important to keep your muscle mass with eating an adequate amount of protein and doing some kind of strength training.
Wow. So, that's not set. There's no one set thing, and that's all the more important for getting in there and talking to these ladies and these pros that Shed It weight loss. So that just kind of blew my mind. So the 2,000 calories isn't set. I mean, you got probably a man that could be 6'5". He probably could go up to 3,000 calories versus a woman that's smaller and skinnier.
And the Fit3D scanner will tell you your metabolic rate. And I think mine, with like my current composition, is like, I think 1,300 something calories a day.
1,300 calories.
And then of course, if I work out, I probably can deduct maybe 300 or 400. But I mean, you eat a donut that's like 500 calories.
Yeah, and that's all the more important too, because you have to figure that out. It isn't just set. That's just, again, that kind of blew my mind. But it's so important because the food that we eat. I find the portions are huge. So you eat that thing of pasta, and that could be your entire daily caloric intake there.
This is why it is so important to fill you up with vegetables and fruits and lean protein.
Yes. And if anybody spends some time on a treadmill, that burning 100 calories, it takes some time. It takes some work. So, boy, oh boy,
you look differently at the donut.
You sure do. You curse that donut a little bit. I know I would.
45 treadmill minutes.
Exactly.
Yeah. Well, ladies, it is a big time, as I mentioned. You said it was, Irina, one of the busiest times of the year for Shed. It's easy to see why. Folks with the New Year's resolution. So if folks out there didn't get a chance to pick up the phone and call, are you taking patients at this time, or how can people reach out?
Oh
and
yes,
get
we
some
absolutely
questions?
take patients. We are really only a phone call away. Call us to schedule an appointment at 318-746-3880. You do not need any referral from your primary care doctor. You can also visit shedit.com for some further information, and also our Facebook and Instagram. It's Shed It on Shed Road.
Real easy to find.
And if you have any questions for me or for Catherine, just give the office a call. And if I'm not available there, they will leave me a message, and I can always call you back.
Fantastic. All right. Well, as we know, the year is 365 days. So, if you got a question now or here in a couple of months, these are the ladies to reach out to. Shed It Weight Loss. Well, we really appreciate both of you being here today.
Thank you.
Thank you
I
for
know
having us.
definitely got a lot more questions for me. I appreciate you answering my questions and our viewers as well. So, ladies, thank you again, and hopefully we'll have you back very soon.
Thank you very much.
Yeah, our pleasure. Hey, you want to get that phone number out one more time?
318-746-3880. Shed It on Shed Road.
All righty, there you have it. Irina Haas-Gaddis, co-owner and CEO of Shed It, and Catherine Rogers, physician's assistant. Lady, thank you again.
Thank you.
Thank
That
you.
was another great Healthline.
We did it.